All right, good morning, everybody. Thanks for joining us this morning on Virtual Community. I'm gonna have everyone muted this morning, and then I'm gonna open it up at the end for questions for Jeanette, and you can also type those into the chat if you would like to. So this morning we have Jeanette Curtis from 211, and she's gonna update us on everything that they do and what some events that they have coming up. So Jeanette, go right ahead. I'll turn it over to you.
All right, thank you. I'm going to try the screen share, see if this works. Oh, my screen went black. That makes me nervous.
Uh-oh. There we go. I can see I see the black, so hopefully that'll keep going. There you go. I see it.
All right. And let me start my slideshow. All right. So, as Rachel said, my name is Jeanette Curtis. I'm the Executive Director at Fairfield County 211. We're also known as Information and Referral Services of Fairfield County. So some folks who have been working in social services longer will refer to us as INR for Information and Referral. Other folks will say 211. It's pretty much the same thing. 211 actually refers to our call center, and Information and Referral kind of encompasses the whole agency. So I wanted to take some time today to kind of talk to you guys about what 211 is. When I do a lot of presentations, they're normally community resource presentations, and I talk a lot about what other agencies have to offer. And I don't always have the opportunity to talk about what our agency is and what we do for our community. So the easiest way to think about what our agency is it's the number to call when you don't know where to turn. A lot of the clients that we work with live in poverty. And the one thing that we've learned is the main commodity that folks have when they live in poverty is time. So we don't ever want to waste a client's time. So we try to gather as much information as we can in regards to social services in the community so that they can call us at 211 and we can go through our assessment process and give them a referral as quickly and efficiently as possible, because we do not want to waste their time. One of the main things that we do at 211 is to help folks navigate a confusing social service system. Communities that don't have 211 will often find their residents contacting 2, 3, 4 different agencies, telling their story time and time again, and then being told, well, I'm sorry, you don't qualify. I'm sorry, we can't help you. Try this other place. If folks call our agency first, we can do the assessment and get them pointed in the right direction. And again, it saves them that time. Right now, 211 is currently statewide throughout Ohio. That is a COVID response. And Fairfield County has picked up serving Hocking County. So, and through the end of the year, our agency is servicing Hocking County for basic human service referrals. Some states have one call center for the entire state. The state of North, they have one call center to cover their entire state. In Ohio, we have about 30 call centers that cover all 88 counties. So it's broken down in different demographic areas that we all serve. And like I said, Fairfield County, we serve Hocking County also. So we are also an accredited agency, and I'm not sure that a lot of people understand that, but AIRS is the Alliance of Information and Referral Systems. It's international. It's the voice for our INR services, and they set the standards by which we deliver our services. They are our accreditation agency. They certify our staff, and it is advantageous that we have that ability to say, these are the standards by which we serve our clients. There's a set best practices for service delivery and organizational effectiveness. So we're not just flying by the seat of our pants. We do have quite a bit of structure in our agency. And one of the things that I get asked a lot is Fairfield County 211. Oh, you must be a county agency. And we're not. Fairfield County 211, the Fairfield County in our name is the demographic we serve. It's not our funding source. We are actually primarily funded through the ADAM board, and that is for our crisis programs, our outreach programs, and our payee services. And then we're also funded through the United Way. The majority of our United Way funding funds our 211 call center specifically. We also receive dollars from the Board of DD to offer MUI reporting and payee services. We receive funding through Community Development Block Grant, and that covers homeless prevention, eviction counseling, project house call, and landlord-tenant issues. And then for senior services, we receive some dollars through Meals on Wheels. But overall, we are a standalone nonprofit, and we do not receive any type of county, city, federal dollars. So how do we serve the community? We call the approach front door case management. We assume that this contact, this phone call, this walk-in, this outreach connection could be the only contact we have with this client. So on this single contact, we need to go through an entire process. We have to collect all of this data. We have to get their demographics. We have to know where they live. We have to know what their household makeup is, what's their income expenses, where are they receiving other services. And then we assess the household and determine the need. You know, what can we help them with today? Are there any secondary referrals that they might need assistance with? And then we do the referral screening. Once we determine where they need the assistance, if there's multiple referrals, we go through a screening process to find the one that fits them best. Then we issue that referral, we give them the information. This is where you need to go. These are the hours. This is the information you need. And then we plan a follow-up if needed. A lot of what we do is planning, whether it's a safety plan, planning follow-ups, helping them come up with a housing plan or an income plan. That's the big component of what we do with our contacts, is a lot of this assessment, the screening. We go through this whole process with the ultimate goal to link the person in need with the appropriate service, which I guess the best visual I can give for you is if you have clients who have this need, and then you have agencies that can fill the need, how do they find each other? So they call 211 and we link them together. So we're the bridge between them to make sure that the agencies are getting qualified candidates, but we're also making sure that the clients are going to an agency that's able to help them. So it saves time on both sides. The top 5 referral areas that we give are financial assistance, food pantries, transportation, information services, and housing. So, and that's not in any particular order, depends on the time of year. I will say that the highest volume of calls that we receive are food calls or in regards to hunger in some capacity. For financial assistance, these referrals are ever changing. There are programs based on the time of year, based on household makeup, based on income. We keep up to date on all of that so that we can make sure that we're issuing the correct referrals. Transportation. So over the last 10 years, we've seen transportation really emerge as an obstacle or service barrier for a lot of the folks who live in Fairfield County. So we try to identify these service gaps and fill them as best that we can. So far, we've implemented programs to assist with gas cards. We've implemented programs to help with bus passes on the loop. And most recently, we've applied for a grant through ODOT with Lancaster Public Transit to add a mobility manager to 211. The mobility manager is going to look at transportation and mobility needs for Fairfield County and come up with a plan to help address those needs. It's not just going to be, how do I get this one client to this one place? It's going to look at the overview of Fairfield County and say, we have folks who are trying to get from Lancaster to Columbus for employment. How can we fix this? How can we get them where they need to go in a cost-effective solution? It's going to look at the needs of certain areas. They're going to say, hey, the west side of Lancaster sidewalks are a mess. Is there any grants that are going to help people with mobility issues with sidewalk safety? So it's going to look at the whole issue of transportation and mobility in Fairfield County and help come up with a plan. And we're pretty excited that we were awarded that grant, and we hope to have that person in place after the first of the year in January. Information services for our agency are simply when folks ask, where can I get this? How do I do that? We just answer a lot of questions. And then housing. We receive a lot of calls not only in regards to Project House Call, which is a housing list that we keep full of apartment communities, and we've captured a lot of the information that folks need when they're looking for a place to live. But we also encounter a lot of questions and referrals about eviction prevention and landlord-tenant issues. So we always have referrals available in place to assist with that. Also, there are several civic organizations in Fairfield County that have programs that will assist our community, but they don't necessarily have the staff in place to field those requests. So we partner with them. The Lions Club has a program called the Gift of Sight, which folks and kids, anyone can sign up to receive a free eye exam and free eyeglasses. A lot of the times eye coverage isn't in medical plans, so this is something that a lot of folks don't have. So we can fill out those applications for them, get them submitted, and then get that voucher issued for them. We also do something similar with the Charity Newsies. They have a back to school clothing program that we assist with, and they also have a holiday program that we assist with. St. Vincent de Paul, the referrals for St. Vincent, whether it's for clothing or utility assistance, they go through us. We will make those referrals because they have a smaller staff over there that don't necessarily have that capability. We also have the 24-hour mental health crisis line for Fairfield County, and we co-facilitate the Suicide Prevention Coalition. So for the Suicide Prevention Coalition, we offer community trainings in regard to suicide prevention, and then we're also certified QPR trainers, and that stands for Question, Persuade, and Refer. It's a gatekeeper training for mental health and suicidality. So if you know someone who could benefit from the training or would like to offer the training, we are certified to do that. We also facilitate the Hunger Coalition, and recently we've had a successful Hunger Action Month where we've collected almost 4,000 items for community food drives during a pandemic, which is pretty amazing. So we're glad to have that support from the community too. So when people talk about the impact of 211, I don't know if they're aware of the sheer volume of calls and clients that we deal with. So in fiscal year 20, which July 1st, 2019 through January 30th, 2020, we actually answered over 59,000 calls. Now to put that in the scope, until 2 months ago, I had 5 staff, including myself. 2 of those were payee. So the majority of those calls were going through 2 people. So that's a large volume of calls. In addition to the 59,000 calls, we issued over 69,000 referrals. And then our unduplicated client count was almost 8,000 for last fiscal year. So that's 8,000 individual unique households in Fairfield County that are calling us for assistance. So when we look at the services that we're providing, again, information services is really high. We had over 12,000 calls for that. And those are the questions: where can I donate? Where can I go? They're the when do I need to, or how can I do this? Those are the questions that we answer with our information services. We had over 2,000 calls for housing and utilities. And those will include financial requests in addition to just questions and answers about eviction, homeless shelters, referrals that are needed like that. Information for individual, family, and community support. This is mostly our payee program. So our payee program currently serves over 100 clients with our latest expansion. And last fiscal year, we had over 5,000 contacts for that. And when we break it down to our units of service, it's actually about double that for our payees. There's not many clients, but there's a lot more that we work with each client for. There's more of that case management that we don't necessarily have with 211 calls. For the clothing, personal household needs, we had over 2,000 calls, and this includes the free stores, furniture, clothing pantries, back to school clothing, just anything in regards to personal and household needs. Mental health and addiction is probably our highest growth area over the last 2 years. We've seen a 76% increase in the number of referrals that we issue in regards to mental health and addiction. Those also include our request for New Horizons mobile assessments, mental health resources, recovery resources, and part of that captures our crisis line calls too, for the referrals that we issue. As you can see, we've had over 38,000 calls for food last year. That is our highest volume of call that we receive. And it's interesting because the food referrals that we issue are the highest volume of call we receive, but they take the least amount of time. So that's always kind of an interesting stat. And then healthcare, when I talked about the gift of sight, we also do referrals for the free clinic, Fairfield Medical, and the community health center. It's the only federally qualified community health center in town, so that they are one that we do refer to. Now, overall, our numbers were slightly up compared to fiscal year 19, but COVID really impacted our fourth quarter numbers, and our call volume was down over 50%. And honestly, I think it's because our community came together so quickly when the pandemic hit that the questions of food and shelter and utilities were answered within the first month, and there was never any lag or service gap. So now we're starting to see our call volume increase as people call in to see if there's help now for rent and utilities since those moratoriums have ended. So our call volume is starting to increase. So in addition to the call center, one of the things that I wanted to take some time to talk to you guys about was the 24-hour crisis line. So we are OMOS certified for behavioral health crisis line and information and referral services. And OMOS is the Ohio Mental Health and Addiction Services Agency. So on the crisis line, regardless of what the call is, the very first thing that we always do is determine safety. So when someone calls the crisis line, we can determine this by simply asking, are you safe? And if they're not in a situation where they can answer that, we can definitely, are you alone? Is there someone there that can help you? So safety is always the first thing that we ensure on every single crisis call. And then these are kind of broad categories, but when a call comes in on the crisis line, and we do the assessment, the safety assessment, to make sure that the person calling is safe, it kind of falls into these different categories. If it's a mental health crisis and we do that safety assessment, then we kind of work that into a crisis assessment. If someone is presenting as suicidal, we move into a lethality assessment, and then we make the determination, is this something we can de-escalate and refer? If so, we do. If it's not, then depending on the acute crisis that the caller is in, we will call in a New Horizons mobile assessment, or if it's even more acute than that, we'll call in law enforcement or first responders to either issue the pink slip or to pick up and transport to the hospital so that they can make that decision. If someone is calling in crisis for addiction and recovery, again, we do the safety assessment, and then we try to look at what support do they need now. We can refer out to AA and NA meetings. We have connections with Project Fort. There's the medical stabilization unit for detox. Ultimately, a lot of the addiction recovery calls we get are supportive calls, so we're able to de-escalate the caller and refer them out to another resource. And then, as some of you know, some of our after-hours services for the crisis line include MUI reporting for the Board of DD. We also handle some rape crisis calls, domestic violence crisis calls, and if someone is calling in to request a New Horizons mobile assessment, we field those calls too. Now, our INR services are available 24 hours, but to reach them, you have to contact the crisis line. So some of the calls that we receive after hours are in regards to, I just got kicked out, where's someplace I can stay tonight? Or I don't have a way to feed my kids tomorrow. Can you help me with that? Those are all crisis. And we don't define what a crisis is for someone. So we will take those after hours calls that we can issue just a referral to, and then connect with the caller the next day to follow up and make sure that they were able to work through the process and follow up on that referral. And then I've included some of the numbers from the crisis line for last fiscal year. We did take over 2,000 calls on the crisis line, in addition to 310 of those calls were MUI reporting for the Board of DD, and almost 500 were mobile assessments for New Horizons. So we see a high volume of calls even on the crisis line. We are also mandated reporters, so we do contact and work with law enforcement, CPS, APS, all the agencies that we need to make sure that safety is ensured. So these are just kind of some general information. All of our staff, and we are fully staffed now, there are 8 of us instead of 4 or 5, which is nice. Our staff have completed Bridges Out of Poverty training, but they're also certified in the QPR mental health first aid. They've completed trauma-informed care and verbal de-escalation training, and then they take a minimum of 1 hour training a month in regards to either information and referral specific trainings or customer service specific trainings. Because even though we are a social service agency, we're still a call center. So we need to make sure that we're having the same level of customer service as a call center as we are for a social service agency. In fiscal year 20, we actually increased the capacity of our payee program, and we did that with a partnership through the Fairfield County Guardianship Board. With funding through the Board of DD and through the ADAM Board, we were able to increase our client caseload to take an additional 25 clients who are receiving guardianship through the Fairfield County Guardianship Board. And all of our payee clients either have severe and chronic mental health issues, they have substance use issues, or they're developmentally disabled. They have to receive a Social Security income in order for us to manage their funds. We also have an outreach component to what we do. A lot of those can be community resource presentations. We set up and meet with folks at resource fairs. We will actually do one-on-one outreach at free meal sites, homeless shelters. We even go to schools to talk to families if need to. So we have the ability to take our services to the community. We have the ability, but thanks to COVID, we're not really doing that right now because of safety issues. So we do a lot of trainings. We have trainings about 211, about community resources, about website navigation for social services. So if you ever have a question in regards to training, we would definitely be able to help you out with that, or at least get you pointed in the right direction. We also do trainings in regards to the Suicide Prevention Coalition and the Hunger Coalition. And then this slide is simply all the different ways that you can contact us. Folks can call us 211, or they can call directly. The crisis line is 687-TALK. We do, so I put a little asterisk next to the walk-in because currently we are not seeing walk-in clients. We are asking that people call and schedule an appointment so that we can restrict the number of people in our lobby. It's kind of small out there, so we actually can't have more than 2. So by scheduling appointments, it helps reduce the number of folks that are in one place at one time. We are located downtown on the corner of Main and Broad Street in Lancaster. And our hours have also changed due to COVID. We're open Monday, Tuesday, Friday from 8 to 3, and then Wednesday and Thursday until 4. Our website has a lot of community resource information on it right now. You can check that out. We have a general info box that you can email. We also have social media, Facebook. We have Twitter, but I'm not so good with the tweets, but I'm doing pretty good on Facebook. So anytime we get information in regards to a community program or a free event or a giveaway, we do try to put that on our Facebook page to share with our community. I think now we have a reach of over 3,000 or 4,000 people, so we do have a pretty good audience that we get that information out to. And we do currently have the ability to offer texting services. Unfortunately, due to COVID, we had to push it back until next spring. So we will start adding a text component next year that folks who need help will be able to reach out to us on their phones. And texting takes less broadband than a phone call. So some folks who don't have the ability to call us on their cell phone can just link up to a Wi-Fi and text us, and we can go ahead and get that taken care of. And that's pretty much all that I have. Do you guys have any specific questions for me?
Jeanette, I don't see any questions in the chat, but I was going to ask you, I know you guys have holiday help coming up. Can you tell us a little bit about that?
Sure. We started issuing referrals for holiday assistance on October 1st. So if you have families or individuals who are looking for any type of holiday assistance, which would include Thanksgiving food, or Christmas gifts, you can have them call us. There's about 20 different agencies or organizations that are offering assistance. So we kind of need to do an initial screening based on the household makeup, where the folks live, to get them the accurate referrals. And we specifically are taking referrals for the Charity Newsies Christmas Box program. This is, I know I'm not supposed to have opinions and recommendations, but it is probably one of the best holiday food boxes that folks can apply for. They will actually deliver the food to the family, and instead of it just being like a turkey or a ham with all the fixings, it's actually a food box that could get a family of 4 through about 2 weeks. And they provide not only perishable items, but they also have taxable items. So they always make sure to include paper products, cleaning supplies, laundry detergent, all of that's included. And if they receive the donations, they also try to include a couple gifts for kids. So that's available on our website if you guys want to fill out the application for clients. This year, due to COVID, we are not going to verify income for the Charity Newsie program. What we're going to do is make it need-based, so it kind of saves time. Folks don't have to turn in paycheck stubs. It's just a self-declared need, and the Charity Newsies will help this year.
That's awesome. That's a very good, a huge benefit. I would like to talk to Charity Newsies and get them on a virtual community right before they start. That would be a great idea.
Okay, so we've started taking those applications now, but I can reach out to them, and I'm not even sure who you would need to contact for them to come here and talk about their programming. But I'll find out, and then I'll have them reach out and get in touch with you.
Great, thank you. I was looking at your slides too while you were talking earlier, and I was just wondering, can you tell me what Project Fort is? I kind of knew a couple of the things, but that one was different. I haven't heard of that.
So Project Fort is a quick response team associated with first responders, and FORT stands for the Fairfield Overdose Response Team. So if EMTs or paramedics, fire department gets a call today in regards of someone who overdosed, whether they were revived with Narcan or not, Project Fort will follow up within 24 hours with that individual and talk to them about recovery supports. They will try to do linkages to recovery, whether it's inpatient or outpatient. They'll link them with resources like the Recovery Center. If it's something that they need that medical stabilization because it's so bad, they can make those referrals. And it's kind of an ongoing thing too. They also help with the entire recovery process by offering supports, whether it's gas cards or even more case management linkage. It's a good resource we have for recovery.
Very cool. Okay, anybody else have any other questions? I don't see any in the chat. You're very thorough. You covered everything. I copied some of your slides onto a Word document so I could save the stuff for later. So if anybody has any questions about that stuff, I could get it out to them. Nobody has any questions. Pam shaking her head. Nope. All right. Well, we really appreciate you being on today and giving us all of that information. And I will post your video to YouTube, and I'll send you that link so that you can share that out and you could share that PowerPoint with others. And we really appreciate your time.
That's great. Thanks for having me.
Bye, guys. Oh, wait, before you go, let me tell you about the rest of the week. Sorry. Thursday on Virtual Community, we have Design and Renew Career and Life Coaching, which will be pretty cool. I haven't heard of them before. They're brand new in the Pickerington area, and I think those will be a really good resource. And next week, we have Young Professionals of Lancaster on Tuesday. And Thursday, we have Dorinda Gear from the Board of DD, and she's going to be talking about able and stable accounts. So if anybody needs those calls, those are coming up. So we look forward to those, and we'll see you all soon. Thank you.